is really meant Today is really meant to be an informal conversation and discussion or roundtable amongst friends. So nothing too formal. We want to have the opportunity to have some significant conversation and honest conversations with Lucica. Before we start, though, I wanted to give a bit of context around why Lucica is in Ottawa from Geneva right now, and also a bit of information about where the Stop to Be Canada network is at in terms of its journey of growth and where it could go from here. And I want this context to be shared with Lucica because she's really seen Stop to Be chapters and networks pop up all over the world, and her insights into how to grow and sustain a network like this would be really, really valuable to us right now, I think. So why is Lucica in Canada, in Ottawa, the nation's capital? Well, yesterday was World TB Day, as everybody is aware, and Canada was the founding donor of TB Reach, which is an innovative financing mechanism of the Stop to Be partnership that works to find people living with TB to get them the care that they need. It's a really, really valuable initiative because it drives forward localized approaches and it tests out new ways of finding people or treating people with TB. So if you think about the bigger TB ecosystem, TB Reach is usually on the front lines of getting new treatments out the door. So TB Alliance's new PBEL treatment, they're supporting getting that into communities. And if and when those projects are successful, then the likes of the Global Fund or bigger donors can come in and scale those efforts up, or local programs themselves. So TB Reach is not only providing localized approaches, it's also critical in those innovative approaches being tested and then scaled in the future. So Canada's been a founding donor of this mechanism. We provided the initial funding in 2010, and we've given sustained resources since then. A couple of years ago, we knew that the funding for TB Reach from Canada was coming to a close because we last invested for 5 years. So we started at Results Canada and also within Stop to Be Canada to start advocating to the Canadian government to make sure that we continue to invest in this really critically important mechanism. So we've been doing advocacy in support of TB Reach for more than a year now, and we were really, really happy to get wind of the fact that the government was starting to take our advocacy seriously and thought, okay, let's push them to really get these resources out the door ASAP. And if we can create a platform for the Minister of International Development to make an announcement and an investment in TB Reach, then not only will we get those resources out the door when we've been waiting a long time to see these resources, we will start building relationships with serious senior leadership in Canada and get him interested in understanding what TB is and why it's critically important to care about TB in the development space so that he becomes a champion in the future. So all this to say, yesterday, we hosted a ministerial event on World TB Day with the Honorable Harjit Sajjan, our Minister of International Development, at the Ottawa sign in the Byward Market that was lit up in red for World TB Day. And he did step up with an investment in TB Reach, $11 million, a one-year investment. Now, it's not what we were looking for. We wanted a multi-year investment, but you bet we will be knocking on his door again to make sure that Canada continues to play its part in TB Reach. So congratulations to all the advocates that were engaged in that effort. Really, really awesome. Lucica spoke, Subesh spoke, who just recently joined the Stop to Be Canada network. He's got on-the-ground experience working with TB Reach in Nepal, so his valuable contributions as to what the impact of this program is in practice was really well received. Okay, so now that's why Lucica was here. Now moving on to some context about where Stop to Be Canada is at in its journey of growth. So right now, Stop to Be Canada is totally volunteer run and led. 2 years ago, it did not look like what it looks like today. It was about 2 years ago that I came to Elizabeth and I said, hey, Elizabeth, I could make a really strong business case within Results Canada to dedicate a significant portion of my full-time staffing hours to reinvigorate the network, to get all the critical comms infrastructure set up, to get a steering committee in place, to maybe get some additional bootstrapped resources going so that we can start to grow this network. What do you think? Are you interested? And she said, yes, let's do it.
That's always been our sort of rate limiting factor, that we were all doing this completely off the side of our desks. So there was no kind of real kind of secretariat support, like writ large, to kind of keep things moving. So it was fantastic to have that.
And honestly, that's what's needed, right? Is staff resources, human resources, and time to do the underlying nitty-gritty work to build an infrastructure and then sustain that infrastructure. So I'm really happy that we've done that. We now have a steering committee of more than 14 people highly engaged in the work that we do. So Elizabeth and Tina the other day did a podcast on, for World TB Day. Tina's reached out to her MP. Trevor's hosting a webinar. Adam Graham, who I see on the call, he's also hosting a French webinar, the first French webinar we're going to be doing in a while. Suvesh stepped up and spoke at the event the other day. The only reason this network is functioning and firing all cylinders is because people are dedicated and people who care are stepping up and doing the work needed. So I want to see a really big round of applause to all the steering members that are here, because none of this would be happening if you weren't around. Woo! Woo! But with this said, we're at a point where we're ready for the next phase. We've got all that core infrastructure in place. We're doing all the day-to-day things, but we don't have specific resources for Stop TB Canada. So we're looking to figure out how to get to that next point where maybe we have a full-time Stop TB Canada staff person in place that's building the network consistently. I think we need somebody that's on the global advocacy side of things. Results Canada is well placed to do that, but we also need some full-time or more time resources to drive forward the domestic advocacy, because our mandate is to be consistently driving both of those agendas. So with that, I'll pass it over to Tina, one of our co-chairs, to introduce herself, and then Elizabeth to kick off our discussion. Over to you, Tina.
Hello, my name is Tina Campbell. I'm, as Robin said, one of the co-chairs of the steering committee. Very honored to be here and nice to chat with all of you. I work in Northern Saskatchewan for a First Nations organization that serves 33 unreserved communities. Yesterday was a really busy and eventful day for our program, me specifically, because I had 3 separate events that I had spoken to, all surrounding the importance of cultural competence and TB care in Indigenous communities. So it was great. And then my TB nurses also had a podcast aired speaking to TB issues, and that was done in the Dene language. So we had a pretty successful day yesterday. So we're still kind of riding off that high. And me and my nurse here, Tiffany, who's driving for me, I almost left Prince Albert without her, actually. We're just that busy, but we're going up to Stony Rapids, so Northern Saskatchewan, to do some TB worker training this weekend. So it's very nice to be here and nice to see all of you guys.
And I'm Elizabeth Ray. I'm the public health physician leading the TB program at Toronto Public Health. So kind of like the counterpart to the work that Tina does, which is very much around Indigenous TB. Almost all of my work is migration-related TB. Half of us in Toronto were born outside of Canada. The huge majority of people ill with TB in Toronto were born outside Canada. So it's very, very much connected with the global pandemic. And I want to thank Lucica for, Lucica spoke at the Ontario TB conference a number of years ago. We've been able to get her to speak a couple of times at the Union North American TB conference. So it's been really wonderful to have that connection. I guess I'm speaking especially for the Ontario TB conference, which is, it's very kind of frontline folks. It's very on the ground, you know, TB care providers. And so to have a connection for us here, you know, right through to the International Stop TB Partnership means a huge lot to see that connection, right, from our daily lives to right around the world. So that's a thank you for all those other talks, in addition to this one. I guess I just want to put a counterpart to Tina's about, you know, lots of events. Our program here in Toronto has been massively hit by COVID. 3/4 of the TB program staff were redeployed to COVID. They're still redeployed to COVID. So we, you know, for years we had a big World TB Day event at City Hall. Couldn't hold that this year, like do not have the capacity to pull it off. So our World TB Day stuff was a whole bunch of online kind of things. The mayor proclaimed World TB Day for the city of Toronto, bunches of stuff like that, but very much kind of online, and some social media stuff, not the kind of in-person events that we've been able to do in the past. So somewhat more constrained than we would normally have been. So, so with that, that's also maybe a lead up to whatever you want to say about you know, the impact of 2 years of a COVID pandemic on TB care. But I guess I'm a lot more interested in, so like, okay, now what? Like the getting back on track part. So with that, maybe I'll turn it over, like straight over to you.
Thank you so much. So I don't know, Robin, you wanted to say something? No, okay. So first of all, so as we said, it's nice because everybody joined from different places, and but I wish one day we are all together in a room. And I have to say that I said last night, I said yesterday, we will, at least on my side, but I know my colleague Jacob, who is here as well, count on us anytime you think that it's useful, either what we say or what we do, what we share. There will never be from our side a no based on the fact that, oh my God, it's too complicated or too difficult to come, to share, to speak, to provide you with information, whatever it is. We will do whatever it takes, because we are, I speak on my name, but I spoke a lot with Jacob about this. We feel extremely honored and impressed with the work that is taking place in Canada by a lot of volunteers. And I know that all of these are coming outside of your usual work, and you know, it's incredible. So that's why never hesitate to ask for anything, because we will do our best to deliver. Second thing that I want to say is that there are two angles here, and these are the angles always, not just in Canada, but in most of the high-income countries where we have platforms and partnership, is the internal angle, as well as the help and what you guys do for the external angle, and for all the people in the world actually with TB. So on the external angle, there are 2-3 things I want to say. First of all, we have, so on the TB situation, first of all, to say, COVID indeed pushed us back big time. And unfortunately, the numbers we see now in terms of the epidemic, in terms of the mortality, are the figures we were having in 2012. So sadly, all the work that we did over all these years was kind of destroyed, and we went back a lot, as I said, to these old figures. And it's indeed very disappointing. And what happened, where you said about staff, it happened almost everywhere in the world. The first ones to go into COVID care were the TB doctors, nurses, healthcare providers, lab people. Also in a big part of the world, I don't know how it's in Canada, but in most countries, the TB hospital, the beds, the dispensaries were also becoming COVID because they had some sort of infection control circuits, and people knew. We working in TB, we know that if you have infected people, they should not stay in the same areas or rooms with those that are to be protected, and so on and so on. So indeed, to the fact that there was a lockdown, to the fact that people were scared, that it came also this entire shift of resources and people towards COVID. So even if there were people that wanted to go to get diagnosed, they didn't have where to go, or there were restrictions with the time frames and so on. So on top of this, $500 million in 2020 from the TB domestic was shifted towards COVID. For us, where money are very little, that's a huge amount because not enough came, it was taken out of us at global level. And to make things worse, a lot of the research that was happening for TB stopped. Enrollment of people, creating the studies, continuing the clinical studies and the clinical phases that were taking place were also stopped. So we were hit on many places. Now, so this is all the difficult part that was related to COVID. On the positive side, if I can say so, COVID showed to us that, to be honest, money are not an issue, are available. Funds can be identified if people are worried or scared or realize the importance of putting investments into public health. It will always, they will always identify sources of funding. It also showed that researchers can work together to develop a new vaccine and, to have it very quickly, as well as, diagnosis, as well as treatments. It also showed it's possible for countries to have live data on COVID and to be available on all our screens, which created indeed this feeling of fear. When you see every day how many people get sick, how many people are tested, how many people die, it's indeed a very worrying situation. We don't have this, not just for TB, we don't have it for HIV, we don't have it for malaria. The data we operate with are 1 year old because these are the latest available data for TB that are guaranteed. It's the WHO system. And this is not against WHO, but it's against the fact that we need to move on and not operate anymore with paper-based data, but should be live data. The only country in the world that has live data is India. And any of us can link and we can find the data of India, what they diagnosed and treated up to yesterday. So we are trying to really push, not only us in Stop TB, but we are pushing for a long time for this. Now Global Fund is keen to support as well to get more accurate data for TB and so on. But also I have to say that there are several countries that observed that there is some big drama happening with their TB response. And that's why they try to accelerate to go back. And I will mention here a very good job done by India and Bangladesh, who almost are back at the level that was when COVID started. So they are not at the level where they should have been in March 2022, but they are at the level where they were when COVID started, which is remarkable. African countries, some of them were actually kind of not doing better, but not doing worse. And that is actually a very good approach as I said, Nigeria, Kenya, few other countries that did pretty well on that, but we have also still high burden countries that are still struggling to go back even to the level when COVID started in February 2022. So in addition to this, so on the global picture, it becomes very clear that the funding that we have for TB is far than insufficient. We know that, and we knew that. I think we never said it very clear, that we try to operate in TB both in research, but also in implementation with less than 40% of the budgets. And we always had this, when we speak about TB, there is this idea that, oh, but there is a lot of domestic resources going into TB. Yes, it is, but that's because we present the data of global level and the numbers are completely, influenced by the big money that countries with the budgets like Brazil, Russia, China are putting into their programs. And if you take them out and you look at just global fund eligible countries that are all high burden countries and lower middle income and low income countries, so the ones with less resources, so Brazil, Russia, China are not there. We observed that in 2020, only $1.9 billion were put by domestic into all these countries. That's very little. If you add here global fund money, which, and another myth that I don't think was ever very clearly explained, Global Fund is the biggest donor to TB, you know, so sometimes when a donor hears that, they are like, wow, that's awesome. It is the bigger donor, but it gives very little money. And TB, if you look at how many people die of TB, HIV, and malaria together, TB is responsible, unfortunately, for the death of 60% of these people. HIV and malaria together are 40%. So TB, unfortunately, kills more people than HIV and malaria together in global fund eligible countries. Well, any normal kid will say, okay, TB needs to get the biggest amount of money, right? It's very logical. You want to fight the disease that kills the most. Well, it's not true. And what we have is that TB gets the least. So HIV gets 50%, malaria gets 32%, TB gets 18%. These 18% represent at last replenishment level around $750 million a year. $750 million. HIV is more than 3 billion. So when you put the 1.9 from domestic with the, let's say even 800 from Global Fund, and maybe a little bit from USAID bilateral because they give some, you arrive roughly at $3 billion a year that we have in all these countries versus a need of 9 billion. So we tried to achieve a lot with 3 billion versus 9 billion need. And I made this comparison because actually for few donors, it became much clearer. I was saying that is like, you want to go from Ottawa to Montreal by car and you know you need to fill the tank. And you say, well, you know, I just put 30% of it and I will go there somehow. Well, you will not. I mean, what we do is we go with 30% of the car in TB. We try to then walk and push the car. We try to do some whatever, but still you will never arrive. So this is our challenge with the funding. And that's why global fund replenishment is very important for all of us, but is not the only answer, unfortunately. Increasing dramatically the domestic and also trying to find other smart ways to increase the funding for TB, it will be very important. So now I will spend probably, I will take 5 more minutes to say 2 things. One is, I'm very happy to speak with you from, one is about Stop TB, Canada and in the general Stop TB partnerships and networks, and the other is about the current period and Ukraine and so on. On the Stop TB partnerships and the fact that we have a strengthened partnership in Canada, this is really great. And as you know, we are there are Stop TB partnerships in donor countries, such as in Canada, such as in US, Japan, Korea, Romania. Now, Romania is not a donor country. And we have probably around 18 in the high burden countries and lower income. And it's our dream to do a face-to-face meeting that we will financially support, that you can meet each other and there can be a lot of intersection and interaction and having a sort of joint planning and effort to push the things forward. In addition to this, because we can also facilitate some more interactions, because a lot of work that Stop TB Canada and the partners, I refer here to Results and you, Robin, and the colleagues there is a lot that you actually do advocating for TB Reach, but in general that helps the countries with the high burden. And it might be a good idea to have some discussions and interactions and seeing, okay, what can be done further together and how. In terms of the agendas and the important things that are happening, I will outline here the G20, UNHLM, and then I will again speak a little bit on pandemic preparedness in Ukraine, but very briefly. So in terms of the things coming up, G20 is hosted this year by Indonesia, next year by India, and the year after by Brazil. All these three countries are high burden TB countries. All the ministers of these countries are in our board. Actually, the India minister is the chair of our board. We managed, God knows, with a collective push, we did a lot of push, I have to tell you, is the to have Indonesia having a G20 TB side event, which never happened under the G20 presidency. We worked very hard on a good agenda, I think, and on a call to action. More remarkable than that, their minister, who was a minister of finance, we had a call in which I told him all these things about money. He had no idea on the finances for TB at global level, no idea. He had this idea that actually domestic resources are very important and TB is doing well. The moment, he's a finance guy, the moment you start telling him this, sir, it's just 30%. Sir, we are operating with huge gaps. He agreed that the focus of the G20 event is TB financing. It's first time ever that some, like on G20 TB side event is about TB financing, you know? So what we try to get out of it is, because, you know, it's not enough to have one flower to say spring comes, is we are already working with India to make sure that there is a continuation of the topic. And we try to have in the G20 communique and call to action, something about creating a TB financing task force or group of people that can continue working. That is not just a meeting in Indonesia and then they are done, but also India and Brazil follow on that. So we will need together to advocate a lot. Canada is a G20 country, that this focus on TB financing is maintained, because Indonesia can push in India, but you might have Canada and UK saying, and in US saying, no, we don't agree, and it can be a problem. But as you imagine, we are also speaking with the UK and, you know, like to make sure that all the others, to make sure Japan and Korea, to make sure that we don't have you know, we have a continuation on this topic. So that's one piece of work. The other piece of work is, as you know, we hope to get the UN high-level meeting in 2023. I mean, it has to happen. We spoke with the President of the General Assembly, who is now from Maldives. The next one will be from Hungary. I have to tell you that it's a difficult moment because, as you imagine, all the people in UN are now busy with the Ukrainian war, and they, you know, it's very, how to say, it's even embarrassing to ask them for a call when you know that, especially the President of the General Assembly. But we spoke with the Maldives one. So I managed, after please begging and stuff, that we spoke, and was very good. He explained that the next one to speak with is the Hungarian, and we approached the Hungarian as well, because what is important is for them to see that we are very interested to have the UN high-level meeting, and also, you know, as last time, we need to have an organization that are basically pushing for having, how to say, not an organization, countries to be co-facilitators. Because if you recall last time, the UN high-level meeting co-facilitators were from Japan and Antigua Barbuda. They usually take a big country and a small country, like by size. So we are dreaming of maybe India or Indonesia or one of these countries to be one of the co-facilitators. We are very, very close to their governments and missions. But of course, it doesn't depend just on them. It's a very complicated process. So starting our board meeting of Stop TB is in May, end of May. And we hope after end of May to start preparations for the UN high-level meeting 2023. So we will have a little task force, not a little, a task force with different partners. So we will make sure we will invite the Canadian colleagues to join that as well, to work on, you know, the UNHLM declaration, but also different tracks to ensure that civil society and communities will be properly engaged, and a lot of things. And I would say, you know, angles that are interesting or important for the country from a TB side should be part of that as well. So that's another piece of work that is very important and heavy. And then there are two more pieces that I want to refer. One is, we spoke about COVID, and you know there are a lot of discussions speaking about pandemic preparedness and response, creating a sort of, I don't know if it will happen or not, but a sort of global, I don't know, a structure or movement around addressing future airborne pandemics. Our effort is to make sure that people understand that TB should be part of it, because usually TB, I mean, we saw TB was good at the work side, you know, sometimes it's happening, you know, you are there when it's about working and delivering. And then a party happens and you that were there working, you are not invited. And a lot of people from God knows where appear that, and you're like, what? I worked and I did all of this and I'm not there. That's how some colleagues on TB are feeling in the country, because there is this situation in which is like, we know that there are discussions about creating a sort of airborne pandemic preparedness response structure, and there is too little discussion around TB, but TB was the one that served as the ground for COVID, so we need to push that a bit more. And then the last point that I want to make is Ukraine. I understood today from a friend, I didn't know that there is a big Ukraine community in Canada here. And I imagine, at least what I'm Romanian and what's happening in Romania and Poland and Moldova, there is a large number of people from Ukraine as refugees. So I imagine there might be as well a lot coming to Canada as well. And I think, I mean, that's not, and this is a, how to say, a fragile discussion. It's a difficult one, but it is a reality. And we spoke with our friends from Ukraine. Ukraine has a big burden of TB and has a big burden of drug-resistant TB. And they were doing big efforts to address it really very well. And the government was very committed. But of course, they were a long time from being having TB properly controlled in Ukraine. You know, a large number of people with MDR not diagnosed, a large number of people with TB not diagnosed, and so on. So it might be worthwhile initiating a conversation even with the authorities on how embracing the refugees coming, it is also secure that there is a proper system to ensure to them access to diagnosis or to treatment without them feeling excluded, but you know, like, but in the meantime, making sure that they get what they need. And in Romania, we speak about putting, you know, having some places where they can do a rapid X-ray or they can do a rapid test, and also having all the information they need in their own language, where to go. So small things like this, like information sharing is not, but you might consider maybe calling for a call with whatever public health authorities in Canada to make sure that they are prepared. It doesn't, it needs to be crafted in a nice, warm, welcoming way, but it's a reality. And we had just now, coming back in my room, I got a message because two people with XDR-TB that were coming from Ukraine, they were in Romania, two ladies, and it was really great because they were received, and they said from the beginning, we have XDR-TB, we don't have any more treatment. So there was really a great mobilization. So they are now in one of our TB hospitals, very well received, actually, each of them on their own room. And they were writing to thank, because yesterday we were speaking about this, and last night this happened. It's unbelievable. So it's not that yesterday was TB day, I was part of a TB event, and I was saying there will be cases. And actually it happened last night that these people from the border called. We said that we have two women here, they have this TB. They were poor women, were wearing two surgical masks on top of each other because they were scared to infect. Really amazing story, but it happened very quickly, you know, so it will happen. So it's good to be prepared. So with this, I will stop here. I think we have 20 minutes to speak, and yeah.
Mm-hmm. So on the Ukraine MDR, you know, sort of rapid movement of people. So I did reach out to people at Immigration Canada this week to ask, like, what's the plan? So it sounds like it's in development, but I agree. Like one of my worries is we don't have tons of multi-drug resistant TB in Canada. So you know, I think the care that people get is good, but the infrastructure is built to treat 20 people a year in the whole country with MDR or XDR TB. So if we had a big influx of additional people who needed care, even just things like accessing MDR TB drugs is a big issue, you know, and you know, easily move, you know, a big movement from Ukraine could double or triple the number of people needing care. So that's kind of something on my mind, because there is a big Ukrainian community in Toronto. And on the prairies, like I'm from,
and a huge
big Ukrainian community there. Yeah.
So, and I was just going to say that although we don't have extensive experience with MDR, XDR in Canada, I think the principles we're comfortable with, and I think it would be a really good idea. I mean, and maybe Stop TB Canada could back something that developed protocols. I mean, one of the key people to know about is the immigrant TB group out of the union that exists in every country and would be really useful. I think that we certainly have TB expertise in Canada that could put together some sort of screening thing and offer it to Immigration Canada. Immigration Canada is going to be behind the 8 ball for sure. We should just go ahead and gift them with some recommendations.
If I can just jump here to say something, because I saw some hands and I don't want to speak myself. I want to say two things. I agree with what Anne said, that there is a tendency of the public health like authorities to say, okay, we need time, and then to say things might be under control, but actually are not. So it's always good to be proactive and provide something and send. And I agree completely that I think we had the same. My best friend in life is the Minister of Health of Romania. So we know each other very well. When all this started, in the first day was a lot of chaos. So I was telling him, because I was working in Kosovo and Albania, and when the war was in that area, so I know the chaos and the craziness. So I kept telling him, you will not be able to control. You really need to put some system in place. Okay, you cannot do it the first day, but it took time, because initially he was like, oh, things will be under control and so on. And then when you start working, it's always good to have something to work with, you know, rather than create from scratch. So I would say preparing something or being proactive to them will probably be very good. The second thing is this, is not just Canada, in the fact that, you know, there is not that much, there are not too many people with MDR or XDR TB that are being treated in Canada. I am on Facebook. Maybe you all know an old friend of mine is from Slovakia, is dealing with TB. He reached out to me and said, I am desperate. He said, my budget for MDR TB that I calculated for 2022 was for 2 people. I know already I have 5. And I think I'll have more. What am I going to do? So what I can tell you for sure, and this is something that we can even make official, is we negotiated from GDF with the manufacturers of second-line drugs to allow the high-income countries such as, I mean, Poland, Slovakia, I mean, even Romania, even though we are far from a high-income country. But anyway, we are EU. We were not allowed to buy medicines from GDF, but not we. These countries, high-income countries, such as I said, all EU, Canada, Australia, with the price that we give to low-income countries, okay? So the price that Canada has to buy drugs, I don't think, first of all, the country comes to GDF, but is a very high price. So now we negotiated with Otsuka, with J&J for a price the same, okay? So it's the low price that is available for MDR-TB drugs that can also, the high-income countries and EU can procure from GDF, and not the expensive drugs that were procured at the time. So that will save. But saying this, money still need to be made available. You know what I mean? So that's a different story. But what I can tell you for sure is that, at least in Europe, money, of course, they will not be enough, but in terms of TB and healthcare, are a lot. Donations are not the biggest problem. The biggest problem is to secure the systems to take care of the people and the circuits. So yeah, so I will stop here. I see Adam and Robin's hands, yeah.
So Adam?
Hi everyone. This is Adam calling in from Vancouver. Sorry for my kind of casual appearance today. I'm on annual leave and I'm just walking my dog on the beach, so forgive that. I guess my question is, and thanks Lucica and Robin and Stop TB steering committee for this discussion. I think it's great. And I guess maybe this sort of question is more related to like, what is the role of sort of non-traditional partners in kind of doing a lot of the work that we need to do around scaling up, say, case finding, access to treatment, and so on and so forth. And I'll give some context in relation to that question. So Plan International, which is the organization that I work for, has done a lot of work with financing from the Global Fund, traditionally on malaria, because there's a connection obviously with women's health and also children's health. And then subsequently, we started to work within the context of HIV, specifically with key populations and adolescent girls and young women. Our kind of foray into the world of TB work came a little bit later. And a lot of that work around TB was sort of built upon really good, strong connections with communities. So for example, community traditional leaders at the community level, as well as our kind of connections with Ministry of Health, district level health authorities, this sort of thing. And one of the experiences that we had most recently with TB Reach funding was a case finding project in Sokoto State, Nigeria, with the Wave 7 financing. And actually it was a really good entry point for an organization, which I would call sort of a non-traditional TB organization, or an organization that does work on TB, to find an entry point into the work on TB because of its focus on gender equality and women's empowerment. So it was, you know, that is where Plan really excels in a lot of this work. And so we found an entry point through sort of that mechanism. And I think we had expertise around TB, but we were also learning as we went through, accompaniment with the Sokoto State Ministry of Health, the central level Nigerian TB program. So there's a lot of like really good lessons being built around that, but I would still say that Plan International is probably a non-traditional TB organization, despite the fact that we sort of have actually uncovered some really good results from that particular TB Reach project, where we, were able to sort of in terms of case finding, we were able to really focus on, for example, child pediatric cases and kind of getting children into that whole care cascade, as well as obviously TB in adults as well. And there's some real successes in that. So I guess, I'll go back to that original question, maybe for Lucica, Jacob, or anybody else on the steering committee. I guess what do you think moving forward is the role of non-traditional organizations in TB to really kind of push forward, strengthen, and commit its own resources perhaps as well, since we're looking at a financing gap? But maybe if just have a couple of reflections from your side on that.
Thank you so much, Adam. So maybe, I don't know, Rob, so maybe Elizabeth, I was thinking we see what, if Robin has a question as well, and then we can answer. I will say some of the things, and then I know Jacob will add to that. What do you think?
Sounds good. So Robin, go ahead.
Go ahead. Would you mind going ahead and answering Adam first, and then I'll come in next? Is that okay?
Yeah, it's absolutely right.
Okay.
I want to say that at before 1:05, I will have to disconnect because we need to evacuate our rooms and leave to the airport. But it's okay. I mean, we stay till like 1:05. We need to. Okay, so I will answer to Adam and also Jacob, if you can add, that will be also good. So first of all, yeah, no problem, Robin, absolutely. you see, we need to change a lot on TB, and also to act in a smart way, because it will be more and more difficult to secure funding just for TB and completely out of context. You know, the people with the money will be like, guys, I cannot just do some things for TB. So for a long time, we promote something that came from the thinking of some of our staff, the reimagining TB care, in which we try on one hand to bring TB care closer to people, like at their front door, but on the other hand, trying to see, is there a possibility to do more than TB in terms of case finding and diagnosis? Can we help that actually when we get a diagnosis for TB, people get diagnosis for other as well? So, and we try to, so there are two angles here. One is involving non-TB, let's say, organization, or having a different focus on simply TB care, let's put it this way, which is basically having them help, support, help work on diagnosis, identification, case finding, screenings, providing treatment for people with TB. And then the other is in working together with them to engage them as well on the more of the advocacy part, the rights and gender, you know, and the inclusion and social justice angle, and so on. And how we do that, we use basically for the previous part on delivering some services, TB Reach, and the new round that is coming now, and Jacob will say, is a round that speaks speaks and calls for integrating service delivery, in which you don't go and do just TB, you try to do, and actually we don't want to see TB and HIV even, because we kept doing TB, HIV, but can we do diabetes, cancer, COPD, pregnancy, nutrition, together, and see, and this will for sure increase, can we basically put people together and have them, you know, do more than TB once you reach somebody. And the other is the challenge facility for civil society, which is the other granting mechanism we have with a lot of USAID funding, which actually last year was, we just had we just had a 9 million round announced, which is never heard of, which is basically trying to push organizations at country level to work together, or even subnational level, to work together with their partners, either in the national partnerships or other TB part, to really engage more in TB and be part of all the conversations around the health system in the country, but as well around advocating in that context for TB interventions. So these are the two tools that we use. I am a strong believer that the more we can aggregate together in a puzzle in which individual benefits in terms of being diagnosed and treated, but also protecting his rights and making sure that access to services is facilitated, the more it will be. Jacob, do you want to add a little bit around TB Reach, please?
Sure. And Adam, it was a great question, and I don't know. It almost sounds like it was a leading question for our announcement in in a few days. So on the 31st of March, this is something that we're really recognizing, and it's our way of trying to push this, you know, force some work outside of the typical disease silos or areas of where people work. So, you know, not to repeat too much what Lucica said, but we really want to look for proposals that bring TB and other services, and it really can be everything from smoking cessation to hepatitis to MCH services, nutrition, anything that makes sense and that you can build some kind of integrated care around, because we're increasingly, not only from a funding standpoint, but from the people who are receiving the care, there's missed opportunities, there's efficiencies from a program side, there's huge potential savings for out of cost for the patient or the person with whatever who's being screened. So it's really something that will be new for the TB world. and we're trying to push this idea and see it's all HIV. There's some diabetes work, TB diabetes, but it's really, it's very limited, I think. And we really hope that this round of TB Reach can begin to explore some potential opportunities. And we hope that we can spread the word enough so that other groups are interested in working with TB as well as other conditions. So the 31st of March we'll announce, and we would certainly appreciate if you get out to the non-traditional kind of TB groups. So that's what I'd like to have.
That's really exciting to hear about coming down the pipeline, Jacob. And how cool would it be if we could start getting other sectors to start doing integrated programs that service and support TB as well. Adam, when you said that TB Reach provided an entry point to plan, my brain just lit up because I was like, that is a selling feature of TB Reach in and of itself, because it helps build the movement. So that I'm taking that away in my advocacy in the future in terms of what the value of TB Reach is in the real world. Last question, Lucica, first of all, welcome any support that you can hook us up with other chapters around the world so we can learn from them, share experiences, and figure out how to take Stop TB Canada to the next level with maybe some sustained funding and staff time and all that kind of thing. So that's where I think we want to go. But I want to hear from you before you have to run. What's the vision? What's the vision for the future of the Stop TB partnership in the context of all of the challenges that we're living through in the world, post-COVID-19, tightened fiscal space, all three crises of conflict, climate, and COVID kind of smashing together in real time and accelerating rapidly? What is your big vision and future for Stop TB partnership?
Well, thank you for that. It's a longer discussion than this 5 minutes, but sadly, and especially because I want to tell you that the direction of thinking around this aspect was dramatically impacted by the situation now, because obviously the bottom line is really ending TB, and more than that, actually, we were very strong discussing in the Stop TB Secretariat, okay, if we end TB in 2030, let's walk backwards from there and see what are the things that slowly have to be either set down or, disappearing or merged into other different aspects. Now, sadly, because of COVID, as I said, I still know that we can do it, but I can tell you that if we are not able to move the needle in a more dramatic way till 2025 and have a serious work on a new vaccine, I doubt that we will be able to end TB, which is not eliminating it, by 2030. So ultimately, we want to go to the ending of TB, but we want as well a Stop TB to be the place in which it's not just about TB in isolation, but more in trying to bring more, make it easier for people affected by TB to access. So it's not just to make sure that they get a diagnosis and treatment, to make sure that they do it easy and seamless and respecting their rights and gender and ensuring there is an embracing of their variety and everything. So which means that basically, in addition to fighting for them to have, or programs to have diagnosis and treatment, is also to make sure that we don't do that in isolation. And also that we push this to happen with a lot of new tools and innovation. So I see us at the forefront in pushing new things to come into TB program and to be embraced at a more rapid rhythm than is happening now. I want to say that sadly, I know we are all pushing very hard, but we have Gene Expert, which there are a lot of discussions around Gene Expert and pricing and so on. But I just want to say Gene Expert, a new diagnosis, we know it works, discovered 12 years ago. It appeared 12 years ago and made available, right? And in 12 years, so it basically in the world now, the feasible solutions for diagnosis are smear and culture or rapid molecular diagnosis, right? That's what we have. I don't go, and of course you have X-ray and other things to come, but in terms of from the sputum, these are the major things. And WHO is recommended rapid molecular diagnosis for everyone, right? And in spite of that, is the figure that I said yesterday, only 1 in 3 people diagnosed for TB are getting a rapid molecular diagnosis. The remaining 2 and 3 are getting clinical, maybe some X-ray and smear microscopy. That's what we have. So as a community, as a world, we don't see a rapid uptake of tools. Huh? It comes from probably the fact that programs are poor, you know, so when you don't have money, and all life you knew that you have money for bread and water, somebody is saying, why don't you buy chocolate? You're like, I would like, but I'm not sure I can afford. So let me be safe and go with the water and bread, you know? So that's why it's extremely important I see us in Stop TB as pushers of new tools to be there and getting new ones as one track. And I see the other piece in making sure that there is the ambition or the advocacy and the comms angle, right? The ambition, the money, and the desire to do this towards, if you ask me what's the ultimate goal, I still hope ending TB by 2030. That's, yeah, I think that's what. And I saw Adam's point saying that's a low uptake. I think, Jacob, if you want, we can share with the group here, if you want, some of the information on the gene expert uptakes. I think, Jacob, there is that slide that I don't know, Sahu or Srinivas did that showed microscopy at these levels and then rapid molecular diagnosis. Almost half of the level of microscopy is taking place in the world in 2020. Really very disappointing, you know, and this is a risk, not only because people are diagnosed with tools which are suboptimal, but if you are a developer, you might not get very excited by this community that is taking the tools so slow. You know, it's like, I'm not going to go into research for these people because it will take them 12 years till they put their hands in place. So, yeah.
Sorry, go ahead.
Go ahead. I was going to say, it's kind of a weird thing that there is only one kind of global platform doing that. Like, why is it just Gene Expert, right? It's actually a much broader technology. Anyway, so go ahead. And then I know it's after 1 o'clock now, so we probably have to wrap up quickly to make sure you get safely to the plane. So yeah, go ahead, Jacob.
No, I was just going to say that diagnostic expansion, we've really seen at a global level a plateau in the last 3 years. There hasn't been much increase in testing, and 15 million cartridges a year, and that's not use, that's procurement. So we don't actually know how much is being used, but it's not more than that. And we know that there's probably 100 million people who are getting tests if you do very rough calculations, and we're only getting to 60% of the people who have TB. So we need far more tests, and the vast majority of people are getting smear still. So and part of that is funding. We need more money to be able to get those tests. They're too expensive. The tests themselves are too expensive. We need cheaper tests, and we need governments to be able to put in more money, ideally, themselves. We need more money from the donors, and we need more money from the governments.
So lots of challenges. This is obviously not like the end of a conversation about all of this. I want to thank you both so much for coming to Canada, and all of the work around the TB Reach efforts and getting that off the ground, at least for the 1 year commitment here in Canada, and for doing this call with us. Really appreciate it and look forward to more ongoing work together. Thank you so much, and safe travels.
So thank you so much. It's actually us to thank you. And as I said, we will always be available to be with you as needed, or if needed, not just like with no reason. CBS seems to have some interest to have a chat with me. I have a friend who on a more personal level said, well, if you are there, why not? So let's see If it happens, I will let you know if it's happening. They seem to be very interested, especially, of course, me being from Romania and the Ukrainian angle. So, but let's see if it's happening. I will, of course, let you know. And I really am impressed with all the work that you are doing. Is not lip service. I genuinely feel very honored and humbled to really know all of you and to see this great work. And I want to make a special thank from the heart to you, Robin. A lot of what happened is because of you. And I will dare to say that also it was because of Robin wrote a very clear and strong message about this. So we decided we have to go. We have to go to Canada. And so I know that this was not about only a message, but all the work and making all these things happen. So thank you, Robin and the team of Results. But thank all of you for all the work that you do. And thank you so much. Thank you.
Thanks so much, Lucica. And of course, teamwork makes the dream work, and it's always a team effort. So Lee has been really critical to doing a lot of the groundwork to supporting the Stop to Be Canada network, and also the trip that you just had here. So it's always a team effort, dream team right here. Have a great, safe flight, and we'll see you soon.
Thank you so much. Take care of you and enjoy the weekend. You all deserve it with big applause. Thank you.
I'm getting Prosecco out tonight.
Thank you.
Bye.
Bye, everyone.
Bye.